Congenital heart disease, also known as a congenital heart defect, is a structural abnormality of the heart present from birth. Included are heart valve defects, problems with the heart's walls like holes, issues with the heart muscle, and bad connections to certain blood vessels.
Simple lesions may not present till adulthood.
Dr. David Magdalani is a Cleveland Clinic cardiologist who specializes in congenital heart disease.
They'll come up to our attention because they're having extra heartbeats, they may feel short of breath, they just don't feel they have that same amount of energy they have, or maybe they had a stroke at a young age.
Congenital heart disease in adults can also present as dizziness or fainting, or even swelling of body tissues or organs. Sometimes defects treated in childhood reemerge in adults, or problems that weren't serious enough to repair have worsened and require treatment.
Many of the complex lesions, the infants when they're born, they would not have survived without some sort of intervention in childhood, which can either be like catheter-based or surgical-based. Being born with congenital heart disease, compared to what it used to be 40, 50 years ago, a lot of these folks are, surviving into teenage years, adult years. They're, living a very fulfilling life. They're fairly healthy. With improvement of medicine and percutaneous interventions and in surgeries, we really have cared all the people even into their adult years, and even have senior citizens with congenital heart disease.
Surgical advances and improved treatment mean more women born with heart issues are now considering motherhood. Thus, the birth of a combined cardiology and obstetrics program at the Cleveland Clinic.
So we wanted to have a clinic where have collaboration between cardiologists as well as high-risk obstetrics, so we can give the patients a coordinated type of visit where we see them before they get pregnant to give them risks of what the pregnancy is depending on their heart problem, follow them through pregnancy, decide on the optimal delivery mode, and then follow them after delivery in the postpartum period. Simple lesions may not cause the patient any problems. The more complex lesions, we really get concerned about them developing heart failure, developing blood clotting issues and stroke, and develop some life-threatening rhythms or just irregular rhythms of the heart.
Irregular heart rhythms can also be problematic during pregnancy.
They will get probably an EKG, which is electrical tracing of the heart. A physical exam is routine for everybody, and we do ultrasound imaging of the heart. For the babies, we also have fetal echocardiograms to monitor their growth in utero.
The Cleveland Clinic even has a special delivery unit dedicated to high-risk pregnancies. An operating room, cath lab, and intensive care unit are right next door and ready for use if needed.
Some of these patients will require just short-term follow-up, some will require lifelong follow-up, because you have to monitor them for complication of the procedure they had in childhood. So transition of care is very important.
For Fox 8, I'm Dr. Marc.